Pulmonary embolism is blood clot moving toward your heart and your lungs. That's the simplest way I can explain that. Now, where that blood clot comes from, usually coming from the legs, although we have other sources. They can come from your pelvis, can come from upper extremity. What's the risk factor for that? Usually younger people, very active people get what we call DVT or deep vein thrombosis. What happens is, for any reason, that if they are sick or they are flying long distances from Europe coming down here, we had few patients like that, or they have genetic predisposition for making clots. That clot forms in the leg, but sometimes it doesn't stay there. If they don't get proper treatment, that clot can move, washed away from the legs and come to the heart and ultimately find its way into the lung. And what happened with these patients are, first of all, they feel there's something wrong with them. They feel short of breath. Sometimes they feel chest pain. In rare instances, it can be fatal. People can drop dead. But more often, these people can compensate and come to the emergency room. The key to treat this pulmonary embolism or clot in the lungs are to receive the proper treatment as soon as possible. So it's important if the patient comes into ED, if they have seems unrelated symptoms, like I have a little bit of leg swelling, that can help the ED physician to pinpoint the diagnosis as quick as possible and give the proper treatment that they need. Now, as a vascular surgeon, I can offer them options other than just blood thinners. The typical treatment for PE is blood thinners, but I can potentially go through minimally invasive route, either through the groin or through the arm, and try to suction the clot out. And that can be very successful intervention with minimal complication. And I have plenty of examples of patients who came in and 24 hours later, they're back to their normal.